Good day, everyone. I'm Angelica Fandino, together with my groupmates Zaini Esponga and Kim De Los Santos. I will be tackling the case report of urethritis in male patient infected with two different isolates of multiple drug-resistant Neisseria gonorrhea. So, what is urethritis? It is the swelling of the urethra, and in this case, it is caused by the sexually transmitted bacteria called Neisseria gonorrhea. So, for our chief complaints, our patient is a 26-year-old male who has been complaining of severe dysuria for 4 days now. Dysuria is the burning feeling that he gets when he is peeing. He's also had mucopurulent penile discharge, or the discharge of a mixture of mucus and pus from the urethra. And he's also had testicular tenderness. History of present illness, as stated, he's had dysuria and penile discharge for 4 days. He's had testicular tenderness. He's also been feeling fatigue and joint pains, arthritis in the knees and ankles 2 weeks prior, and eye irritation, redness, eyelid edema or eyelid swelling, and conjunctivitis. All this because of the bacteria Neisseria gonorrhea. Past medical history, our patient seems to be healthy because there is no medications reported, no allergies, and no surgical history either. His social history, on the other hand, he has been sexually active. He's had multiple heterosexual relationships, which means he's been having sex with women, and the last sexual contact was 8 days prior to symptoms. The review of systems. In general, he's had fatigue. His reproductive system has been infected because he's had urethritis, mucopurulent penile discharge, and testicular tenderness. In his musculoskeletal system, he's had arthritis in his knees and in his ankles. His visual system is also affected. He's had eye irritation, redness, eyelid edema, and conjunctivitis. Physical examinations. His vital signs are normal. His blood pressure is 110/79, normal. His pulse is 75 beats per minute, also normal, and normal temperature of 37.6. In the laboratory and diagnostic studies, they underwent a microbiological test. They took swabs from his urethra and from his eyes. They also took blood samples, and they are placed on special nutrient rich plates like the Thayer Martin and chocolate agar plates, and they are designed so that bacteria can grow on them so that they can identify what bacteria that is. Microscopy. So, under the microscope, it is found that we are dealing with the pink to red diplococci, which is normally found in Neisseria gonorrhea. It's also confirmed by the cytochrome C oxidase test. It turns blue if there are certain enzymes found from the Neisseria gonorrhea. And in the MALDI TOF, it's also positive of Neisseria gonorrhea because here they look for the proteins found in that bacteria. In the susceptibility testing, here they test out which antibiotics are best to cure the infection. So, with the Kirby Bauer disc diffusion method, the discs are soaked in different antibiotics and placed with the bacteria to find out which ones are more effective. So, it is shown that there is resistant to multiple antibiotics. That is because of the presence of the beta lactamase enzyme, which is an enzyme that renders most antibiotics ineffective. However, it is shown that the bacteria can be treated with gentamicin, rifampicin, and azithromycin. In the RAPD, it is shown that there are two different strands of Neisseria gonorrhea, which means there is a possibility of other infections. Clinical assessment. It is proven there is bacterial urethritis, conjunctivitis, and arthritis caused by the multiple drug-resistant Neisseria gonorrhea. Treatment plan. For medication, he will be given gentamicin in the IV infusion, IV form, 240 milligrams over 30 minutes. And he will also take azithromycin 2 grams orally, so in pill form. He will take 2 grams orally, a sing a single dose every day over 1 week. And in his supportive care, he'll also be given normal saline for his eye infection, and he will have to wash his eye with the normal saline 4 times a day for 1 week. Evolution of signs and symptoms. Luckily, our patient has complete recovery achieved within that 1 week, so there are no more symptoms of urethritis, eye infection, and such. So there's the effective treatment of the Neisseria gonorrhea and effective treatment of possible co-infection with chlamydia trachomitis. That is all. Thank you for listening.